Another 26 suspected deaths were recorded in the past 24 hours, bringing the total to more than 130. There are at least 500 suspected cases of Ebola. The WHO has scaled up its response, deploying additional supplies and personnel after earlier declaring the outbreak an international health emergency. But the UN Health Agency warns that funding shortages are impacting its ability to fight the outbreak after its biggest donor, the US, withdrew membership in January.
The funding for the humanitarian health sector has decreased by 70%. The financing for water and sanitation, which is also extremely important, has decreased by 73% over a year. So imagine, the impact is tremendous.
Top DRC officials convened to address the outbreak concentrated in the northeastern Ituri province, but it has spread to other provinces in neighboring Uganda. Special treatment centers have been set up in hardest hit areas. Local health authorities have advised residents to wear face masks as fear spreads among communities.
Boga yenye niko nayo ni kuipelekea jamaa yangu juu mimi niko nazunguruka mbati ya mingi. Mimi naogopa kukufa. Mimi naogopa kukufa na kuipelekea magonjwa ya familia. Ndio mimi naogopa ile. Ndio yenye mimi naogopa ile sana.
Maladi wana papeza somo. Po malada wane yaka di boso bato basila. Toyoki lisusu keye. Maladi wana soko lingwe invite yango na kati ya ndako biso ba mama. Ifale kosokola maboko. Ifale kozala propreté sala na badouche bisika na bisika. Otango maladi wana eyak. Okeko mutakufi. Okeko simbe bembe. Okomona contamine eza maladie contagieuse. Okokontamine yango ti na yo poko ya kokufa. Okoki kokufa ata chaîne ya 4 bato 5 bato. Bona maladi wana.
The outbreak is caused by the rare Ebola strain Bundibugyo, which has no approved vaccine or treatment. Africa's Centers for Disease Control and Prevention say they are assessing 3 experimental vaccines. The WHO says it may take 2 months before doses can be made available. Well, for more on the Ebola outbreak in Africa, let's talk to Dr. Nahid Bhadelia, founding director at Boston University's Center on Emerging Infectious Diseases. Dr. Bhadelia, thank you so much for joining us. I want to ask you, first of all, about what the WHO has been saying. It's already called it a public health emergency of international concern. The chief, Tedros Ghebreyesus, now saying he's deeply concerned about the scale and speed of the outbreak in DR Congo and Uganda. So translate that for us, if you can, into practical terms. If someone is watching this in this part of the world, I mean, what does it actually mean?
Yeah, Arnold, I think that this is particularly grave for the regional global health security perspective, but there's no global pandemic risks. Let me start by saying that, because this is not the same type of pathogen as COVID-19. It does take close contact. The reason Dr. Tedros has convened the emergency committee and declared this a public health emergency is because this is DRC's 17th Ebola outbreak, and majority of the recent Ebola and other viral hemorrhagic fever outbreaks have been pretty quickly detected and handled within a matter of weeks. The trouble with this is everything about this outbreak so far is telling us that we aren't discovering a new outbreak. We are just surfacing more details about an outbreak that has been going on for a while. So that's the number of suspect cases and deaths that we see, but also how widespread it is. Currently, there's 2 cases in Kampala that are unrelated to each other. They both came from Ituri, the northern part of DRC, where the outbreak is located. And then also in 3 or 4 metropolitan areas, in addition to Kampala, you see cases in Butembo, Bunia, and Goma, which is at the southern border of DRC near Rwanda. All of that, as someone who's worked in that area, Arnold, I worked at the border of DRC and Uganda. The roads aren't very good, and Bunia and Kampala are over 450 kilometers. That means it takes days. All of that means that this is complicated in addition to the fact that it is an area that's affected by conflict, by a refugee crisis, and of course, the withdrawal of aid that's left the area with health crisis.
Understood, Dr. Bhadelia. Let's talk about this particular strain of the Ebola. I'm told that this is something that has a lower mortality rate. 30% is the number I've come across, and also it is rarer, but still transmitted via close contact and bodily fluids. Is that how we should be understanding this virus as well?
That's right. This is the third ever Bundibugyo Ebola virus disease outbreak ever. And it is a species that we haven't seen that much. That means we don't have as much clinical experience, but also because it hasn't been that common, there haven't been as much investments in vaccines and therapeutics. That's why there's going to be that delay, because as you start investing resources, it may take time to prove their safety and efficacy and then to be able to deploy it. I would all viral hemorrhagic fevers, they don't transmit like respiratory viruses. They require close contact to bodily fluids. And generally the people who are at risk are healthcare workers, as well as people who are close contacts, family members taking care of sick patients. And as you heard one of the folks that were interviewed, the concern is that as people get sicker, they have more virus in their body. And if they're deceased and there aren't safe burials, that may serve as another way to transmit the disease. It presents the same way as Zaire virus, which is early on. I actually took care of hundreds of Ebola patients in West Africa, Ebola epidemic. All of the early patients appear like typhoid or malaria cases. It's only in the later cases that you may see hemorrhagic fevers and other presentations. And yes, this does have traditionally lower mortality than what we would see with Ebola Zaire, but I would also take that with a grain of salt, because mortality is generally related to not just the pathogen, but also the health system in which people present.
Understood. The other question I also have, Doctor, is someone with the virus already infectious? I mean, despite, perhaps not showing the symptoms that we recognize, you're talking about how they might resemble malaria.
So thankfully not. One of the good news parts of the good news here are that with Ebola patients, the virus is only transmissible after somebody is symptomatic. So that's when there's enough virus in their body that they can transmit to others. And they become more viremic as they get sicker, which means that there isn't asymptomatic or pre-symptomatic spread the way we are used to thinking of, for example, with COVID-19 or with measles even in the first few days beforehand.
And if someone right now is thinking, I'm going to be doing a lot of traveling over the next few weeks, maybe not to Africa, not to DR Congo or Uganda, but is at the same time concerned about transmission at airports, maybe on board planes or at conferences, where people mingle very closely. Is there something, anything someone can do to reduce the risk of severe infection or perhaps fight it?
Well, I want to put people's minds at ease. I mean, most of what's happening, part of the reason it's complicated is it's happening in very remote areas. So the chances of someone with Ebola boarding a plane and leaving one of these areas is pretty low to begin with. And again, because of the fact that the disease is not transmissible until somebody's symptomatic, one of the things that has worked really well in the past are airport screenings, particularly for patients or passengers coming from those areas on both sides, when people are boarding and when they're leaving. And that's one of the things that all the affected countries are putting into place. It's always a good idea if you're traveling for long flights to, of course, maintain good hygiene, wash your hands, and wear a mask, particularly if you think there might be people who might be sick around you or if you yourself might be sick. But I wouldn't do it because of Ebola. I would do it just because it's good hygiene.
Understood. There are reports, Doctor, that suggest authorities were late in discovering the outbreak. I know you talked about some of the difficulties because of the logistics, the terrain. I also am wondering whether or not funding shortages that have been discussed right now, particularly cuts to USAID, is this a factor, a big factor at this moment as well?
One of the complicating factors was that the early tests were negative for Ebola, partly because I think they were not testing for this particular strain, or it may also be the quality of samples were not that good. But Arnold, I think there are three reasons in which ways in which I think the USAID withdrawal has affected this. One, because 80% of USAID's programs were canceled. Funding for things like malaria medications and bed nets and other sanitation programs have gone down. That means other endemic diseases like malaria and cholera have increased in the area. So if Ebola is kind of like a needle in a haystack, and the haystack of endemic infectious diseases has gone up, it makes it harder to find the Ebola cases out of that. So that's one way. Second is a recent study showed that USAID withdrawal in areas that are dependent on the aid and are conflict prone, conflict has gotten worse. And that's certainly the case in DRC, where we saw M23 take over Goma, which is at the border of Rwanda, just days after USAID was pulled out. And then lastly, I think it's going to impact the future response, because generally CDC and USAID are on the ground and are part of that coordination. And USAID plays a big role in procurement of many of the things that are used in Ebola treatment units. And even though the US has now allocated $13 million, turning those dollars into contracts and procurements, into resources that make it to the ground, is going to take a little bit of time. So that delay, I would say, is also something that's a result of the USAID program cancellations.
All right, Dr. Bhadelia, we do have to leave it there, but appreciate you giving us a better understanding of the disease. Dr. Nahid Bhadelia is founding director at Boston University Center on Emerging Infectious Diseases.